Hello, everybody. Welcome to the Natural Food Pantry Education Initiative. Joining me for a discussion on blood sugar management is Dr. Kate Rheaume, naturopathic doctor. Dr. Kate Rheaume is a graduate and former faculty member of the Canadian College of Naturopathic Medicine. As a very reputable educator, Dr. Kate speaks internationally on many topics related to health and wellness. She is the author of the best-selling book, Vitamin K2 and the Calcium Paradox: How a Little Known Vitamin Could Save Your Life, and is a very regular speaker here at the Natural Food Pantry Education Initiative. Welcome back, Dr. Kate. It's so wonderful to have you back for a discussion on blood sugar.
Thanks, Natasha. Great to be back. Great to see you again.
Good to see you too. So I think a lot of people believe that maintaining healthy eating habits, maintaining healthy weight, maintaining health in general is simply a matter of willpower. And I think it's really much more complex than that. And that can really set people up for, that belief can really set people up for failure, because a lot of us get trapped believing that and then, succumbing to cravings or perhaps a little impulse eating, which is very common for most people to experience at some point in their life. And then they get trapped in this vicious cycle of believing that they failed in some way. The shame, the guilt kicks in, and that cycles back to, more unhealthy eating patterns, maybe binge eating more sugar, going for stimulants. So, the truth is that healthy eating habits involve a lot more than just willpower. There's a lot more to it. And there's many underlying health issues that can contribute to unhealthy eating patterns or cravings, for instance. Can you talk to us about some of that?
Absolutely. Especially when it comes to cravings. Those are in general not, moral failings. Those are actually often driven by physiological processes, usually brain cells that are sensing changes in either nutrient levels in the body or even hormones, and they are then sending you messages to want to eat certain foods. And you can maybe overcome those cravings to a certain extent through willpower, but not necessarily. And not being able to do that is absolutely not any kind of personal failing. And so that indeed can become an issue for a lot of people. It can become very emotional, very fraught, when in fact, there are other ways to deal with those cravings, and making them go away is usually a more functional approach than just trying to overcome them with your mind.
Right. So what are some things people can do to help overcome those cravings?
Well, it depends on what the craving is. Certainly, one of the most common cravings that really drives people and can end up feeling like they're defeating healthy eating habits is cravings for sweets or starchy foods. This can come on at any time of the day, but later in the evening is common, a late night sweet tooth, or a desire to snack between dinner and bedtime, like constant snacking after supper. Those two are actually related. And frequently, surprisingly, they're related to blood sugar fluctuations. And that can be the driving force behind those types of cravings. There are certain brain cells whose job it is to monitor blood sugar levels. And when they sense those are dropping, those brain cells will drive you to eat. And they won't drive you to eat carrots and celery. They're going to drive you to eat sweet or starchy foods. And so, again, you can try using willpower to overcome those cravings, but you won't be able to trick the brain cells for very long. But if there's things you can do to, for example, straighten out the blood sugar, flatten that out, and those cravings will likely resolve.
Okay, great. So let's talk about that. What can we do to help regulate blood sugar levels? Because I think a lot of people have blood sugar fluctuations or experience blood fluctuations, particularly if they're not, educated and knowledgeable on how they can maintain control over that.
Blood sugar fluctuations are really common, and far more common than people would think. And they really are a driving force behind what we want to eat, how much we want to eat, when we want to eat. And you might not even know that you have them or be aware that you have them, or maybe you've had your blood sugar tested and it was been told it was normal because that was based on, one time in the day, first thing in the morning. That says nothing about what's happening with your blood sugar for the rest of the day. And so, having these cravings, it's when blood sugar goes up, say that we've just eaten, for example, we've all heard high blood sugar isn't a good thing, but it doesn't feel bad. It's when blood sugar starts to drop that it will trigger a number of processes that will drive us to eat. If the blood sugar is dropping really fast, some people will experience hunger. You've probably heard of that, when you get hungry and irritable because there's adrenaline being produced. So it actually, these up and down, these swings in the blood sugar really can affect us quite dramatically throughout the day, and again, particularly in what we want to eat.
Yeah. And how does blood sugar affect body composition?
This is really important. So when the blood sugar is up and down, and again, this is for people who may have been told they have normal blood sugar based on a first single morning test, your blood sugar can still be fluctuating throughout the day. And often this is associated with higher insulin levels, this up and down in the blood sugar. Insulin is a fat storage hormone. So this phenomenon is encouraging your body to store more fat, especially abdominal fat. And so it contributes to weight gain, and because it's contributing to cravings, then that perpetuates that cycle and that desire to take in more food.
It really is a vicious cycle. And so
Mm-hmm.
you talked about how it's connected to weight gain. What are some of the other long-term risks to health or to unbalanced blood sugar levels?
This is one of the earliest signs and symptoms of, or phenomena, or things that happen in a condition that ultimately develops into what we call metabolic syndrome. And so this is characterized by, again, carrying excess weight, especially around the middle, but it's also associated with down the road, it can be diabetes, heart disease, a whole host of quite serious conditions that are, what we call these pre-existing conditions. They really can affect our overall health in a number of ways.
And how can somebody regain control over their blood sugar levels? So what would be the first step or the most important step in regulating blood sugar?
Well, the food choices that we make can really either contribute to more blood sugar fluctuations or to help stabilize those blood sugar fluctuations. So certain components of our food, protein, fat, and fiber, those three macronutrients are very stabilizing to the blood sugar. So trying to have those throughout the day. So thinking about your meals and whether they include those components. And it's especially important what you have at the beginning of the day. Less important when you have your breakfast as what is in your breakfast, because that will set the tone for your blood sugar for the rest of the day. And studies have shown what you eat at one meal affects what you want to eat and how much you want to eat at a subsequent meal, one or two subsequent meals. And so really how you start your day can help keep blood sugar more stable throughout the day.
Absolutely. I've noticed that both personally, I've noticed it with my family members. So that first meal it's so important to include protein and fiber and some kind of a good fat that really helps to prevent those cravings later on in the day and
Mm-hmm.
those mid-afternoon or early afternoon crashes as well.
Yes, that energy crash, the 3 p.m. slump. A lot of people want to reach for a coffee and a muffin. That's a telltale sign of a blood sugar drop, and that's probably a phenomenon that's happening throughout the day.
Yeah. So there's a new product, a fairly new product on the market called Real Easy with PGX, and it's designed to help heal metabolism and to help regulate blood sugar levels and deal with these metabolic disorders. Can you tell us a little bit about this product?
Mm-hmm. So, as I mentioned, one of the most effective ways, well, really the most effective way to stabilize your blood sugar is with protein, fat, and fiber. And certain types of fibers, soluble fibers, specific ones, are especially helpful in stabilizing blood sugar. And PGX itself has actually been on the market and it was developed almost 20 years ago now, but it is now available in a new format that's very easy to take. And it provides three different soluble fibers that have been shown in clinical trials to, yes, make people feel full, and so they eat less. But more importantly, from this perspective, it's been shown to flatten and stabilize this erratic blood sugar. And so when you can do that, it can be very healing to the metabolism. It can help lower insulin levels. It can help remove cravings. And so by including this in your diet once or twice a day can really flatten the blood sugar fluctuations. And the Real Easy is a form of PGX that includes fiber, vitamins, minerals, everything you need for a meal replacement. So you can replace either breakfast and or lunch with that to really get that blood sugar flattening effect, as well as a feeling of fullness throughout the day.
Could that be used for people who have smoothies regularly in the morning? Could that be used as part of their smoothie, or would you recommend just having it alone with water?
No, it can absolutely be put into a smoothie because it already contains protein, which most people are putting into their smoothies, vitamins and minerals, and the PGX fiber for stabilizing blood sugar. So it's ideal for people who are already used to having smoothies, but for individuals who are not sure what to eat, how to have a balanced breakfast, maybe they're in a rush or they're on the go, or they really need a lot of help quickly to get the blood sugar fluctuation under control, it's a great choice for that too.
Excellent. And is this a product that someone would take long term, or is it something that they would take for a short time while they work on balancing diet?
It's really flexible. It's absolutely safe to take long term. It's a food, and it's safe to be taken as such. Some individuals will say maybe reach a goal weight or feel like they have achieved their goals in terms of cravings being gone, and then they will go off that. Or some individuals may decide that they like the convenience and the feeling that they have with it, and so will stick with it longer or take it occasionally.
Okay, great. It sounds like a product that would be really beneficial for a lot of people.
Mm-hmm.
And on January 18th, you're going to be offering a webinar on this topic. So extending this topic and teaching us more about blood sugar management, about this Real Easy protein product. Can you tell us a little bit about what we can expect to learn at the webinar?
Mm-hmm. Well, we'll expand on everything we've been talking about, what the best way is to deal with cravings, different components of our nutrition and how that affects our weight and our overall metabolic health. And I think the important thing to be aware of is just because you've had a normal blood sugar test, based on a fasting test, doesn't mean you don't have these fluctuations. And if you're having symptoms like cravings, sweet foods, starchy foods, snacking in the evening, any of those things, then you likely would benefit from the information in the webinar.
I think that covers 100% of us. Excellent. Well, thanks again for returning and informing us on this topic, Dr. Kate. I'm really looking forward to the webinar on January 18th. For those who would like more information on the webinar or would like to register, please visit our website at naturalfoodpantry.ca. Be sure to follow us on Facebook, Instagram, and YouTube. Stay healthy, everybody. Take care.